Much, and all of us, I think, at the Senate are really interested in sober second thought on this issue, and I feel personally that we are going too far, too fast. And my question is, I know you had the task force, and the task force did a job. I'm not sure the task force spoke to everybody. I don't know who exactly they spoke to, although I did look at the list and it was extensive. However, as things progress and more information comes forward, more and more concern is being shown about the age limit. And when I hear you talking about we've chose the age to keep illicit and harmful cannabis out of the hands of children, I ask myself, aren't there other ways of doing this? I see very strongly that by saying it's legal at age 18, you're giving a very strong message to young people that it's okay. That at age 18, it's okay to smoke marijuana. And the evidence is coming more and more strongly that it's not okay. It's not okay at any age to smoke marijuana in terms of harms to your health. So I really want to know, would you be willing to listen to an amendment on the age and perhaps to raise it, knowing that we can always lower it again later, but once it's established at 18, it's very, very hard to raise it up where we are actually protecting young people.
I think we have to look at the current situation that we are faced with in this country right now when we look at the age of consumption of cannabis use. Again, when we look at the research shows us that youth between the ages of 15 and 24 are amongst the highest users of cannabis in the world. So if we want to deter them from entering from getting their unregulated substance from an unregulated source, we certainly have to make sure that we put them in the other system. And moving forward with the age of 18, again, the minimum age that's been set, we feel that that it's the right balance. We certainly recognize that kids nowadays, there is a 30% range that we see that are accessing cannabis through the illegal market. We want to make sure that we prevent them from getting that substance, and that's why we're proposing to moving forward with the minimum age of 18. We certainly don't want that age group to have access to cannabis. And the ones that are of legal age, we certainly want to make sure that they have access to a regulated product that is going to be sold in a government facility.
Okay, Mr. Blair, you have a further response?
The age of 18 is the law. Federal law recognizes that the age of majority in our provinces is either 18 or 19. The law actually written says at a minimum in the federal law it's 18, but we gave the provinces the right to frankly harmonize, their approach to other harmful substances with their age of majority, and that's precisely what they've done. There's an age, and part of the consideration in the task force discussion, and I think I can share this with you, was we looked at a number of risky behaviors that adults are allowed to make choices about the use of tobacco, about the use of alcohol, getting married, having children, getting a mortgage, for a police officer to carry a gun or to join the military, fight in a war. We say at the age of majority, and vote too, by the way, at the age of majority, you're deemed to be in our society and in our law of an age to make informed decisions about your own health and safety. And there was a recognition of that tradition within our society, that at the age of majority, as determined by the provinces, that authority would be extended to the decisions around the use or not with respect to this drug as well. Quite frankly, the health risk profiles of other substances, particularly tobacco and alcohol, are in many ways far more significant and serious than the health risk profile of cannabis. And so we were trying to be also consistent with the way in which Canadian society has historically approached those other risky substances.
Thank you very much. Okay, I have Senators Manning, Munson, and Ahmedvar left.